Screening for prostate cancer has become extremely controversial. Should healthy men have this test or wait for symptoms? This is the People's Pharmacy with Terry and Joe Graydon.
The U.S. Preventive Services Task Force created a firestorm when it suggested routine PSA testing should be reconsidered. The debate echoes the emotional response to proposed changes in mammogram screening for breast cancer several years ago.
What should men do when faced with such confusion in the medical community? Can prostate cancer be prevented? If it is diagnosed, what are the treatment options?
Coming up on the People's Pharmacy, we talk with Dr. Aaron Katz to learn everything you need to know about conventional and integrative therapies for prostate cancer.
First, this news.
In the People's Pharmacy health headlines, resting a laptop computer in your lap might not be healthy for the gonads. At least that's the preliminary conclusion from a study of 29 healthy men. Researchers exposed semen samples to the electromagnetic field generated by a laptop connected to the web through Wi-Fi. After 4 hours, the investigators tested the sperm for motility. Roughly 1/4 were not moving. In a control sample, 14% lost motility over 4 hours, even though the temperature was identical. There was also more DNA damage in the Wi-Fi exposed sperm. The authors of the study conclude that our data suggest the use of a laptop computer wirelessly connected to the internet and positioned near the male reproductive organs may reduce human sperm quality. Several experts caution that it's far too soon to conclude that laptops affect fertility, and more research is necessary.
Heading a soccer ball may be hard on your brain. 32 amateur soccer players underwent MRI brain scans. The investigators used diffusion tensor imaging and found that players who headed the ball over 1,000 times annually had alterations in the white matter of the brain. The areas that were affected are associated with vision, attention, planning, memory, and organizing. A previous study of the same soccer players had shown that those who headed the ball this frequently did worse on tests of reaction time and memory. While these players were adults, they have been playing soccer since they were youngsters. The American Academy of Pediatrics has not recommended banning heading for young players, but has suggested that the maneuver should be kept to a minimum.
New Yorkers who ate a diet rich in fish, vegetables, and legumes reduced their risk of a heart attack. This might sound familiar. The Mediterranean diet that has been shown to be heart healthy is rich in vegetables and gets much of its protein from beans and fish. In this study, 2,500 people living in Manhattan were followed for 9 years. About half the volunteers were Hispanic and approximately a quarter were African American. All the participants were over 40 years old. People's eating habits were rated at the beginning of the study on a scale that measured how close the diets were to a traditional Mediterranean diet. Those who scored highest had the lowest chance of a lethal heart attack or a pulmonary embolism. Even the diets with the most vegetables and fish, however, did not provide protection from stroke. The lead investigator acknowledges that this study doesn't prove that a Mediterranean-type diet can protect people from heart disease. But he points out it might help and it won't hurt.
Evidence has been building that low levels of vitamin D may increase the risk of heart disease. But until now, scientists have not known whether supplements of this vitamin could have a beneficial effect. Researchers at the University of Kansas analyzed data from more than 10,000 people. About 70% of them were low in vitamin D. People who were deficient in this nutrient were twice as likely to be diagnosed with diabetes and 40% more likely to have hypertension. Most significant, those deficient in vitamin D were 3 times more likely to have died for any reason during the study. There was one surprising bright spot, however. People who took vitamin D supplements reduced their risk of death during the study by about 60%, far more than the investigators anticipated. Although this kind of study is not the gold standard of a randomized double-blind experiment, it does provide more evidence that vitamin D plays a crucial role in heart health.
Researchers have known for some time that the biochemical choline is critical for the proper neurological development of newborns. This compound is the basic building block for the neurotransmitter acetylcholine. Now, scientists have evidence that choline intake over the lifespan may affect cognitive function in later years. Investigators collected dietary information on roughly 1,400 middle-aged adults. Over the next decade, the study participants were given tests of memory and cognitive ability. Some also underwent MRI scans of their brains. Those with higher choline intake scored better on mental function tests. Foods high in choline include eggs, liver, milk, oily fish, chicken, and soybeans. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Today on the People's Pharmacy, we're tackling a controversial and confusing health problem. Cancerous cells can be detected in the prostate of 1 man in 3 by the age of 40. By the time a man reaches 80, that likelihood is 4 out of 5, or 80%, will have prostate cancer. But the chance of dying of prostate cancer is far lower, perhaps as low as 3 or 4%.
Several weeks ago, the U.S. Preventive Services Task Force created a firestorm of controversy when it suggested that routine PSA screening should be dropped. This week in the New England Journal of Medicine, there are several perspectives on that recommendation. Some experts agree that PSA screening is creating unnecessary anxiety and not providing significant benefit. Others say PSA screening saves lives.
To help us make sense of all this confusion, we turn to Dr. Aaron Katz, Director for the Center for Holistic Urology and Professor of Clinical Urology at Columbia University College of Physicians and Surgeons. He's author of The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies. Welcome to the People's Pharmacy, Dr. Katz.
Thank you for having me.
Dr. Katz, let's begin with some very simple stuff. I'm not sure we all know where the prostate gland is and what it does, so please give us the what, where, and why of the prostate.
Well, that's always a good place to start. The prostate is a small gland that sits underneath the bladder, and its function really is to provide the nutrients for sperm during fertilization. So if you're born, and there are a population of men that are actually born without a prostate, and you say, well, maybe that's a good thing. But if you're born without a prostate, then you can't have normal fertilization, and you'd have to do something like an in vitro fertilization in order to become a biological father. So it's important for fertilization, and anything that we do to the prostate, like for prostate cancer, if we do radiation or surgery and remove it, men need to know about that. And it sits rather strategically right underneath the bladder and surrounds the urinary tube called the urethra. And that's important because as the prostate grows, as men get older, and the prostate does grow normally into a benign fashion, that's called benign prostatic hyperplasia, that growth can push in on that urinary tube and can cause men a lot of significant urinary tract symptoms. Some of the more common ones like getting up at night, not having as much force of your urinary stream, having to push or strain. And, in severe cases, if the prostate grows too much, men can wind up in urinary retention and require a catheter. And those symptoms of benign growth may not necessarily be due to prostate cancer. Although we do see, as you mentioned earlier, that as men are getting older, the incidence of prostate cancer and the benign condition seem to coexist. But today, in 2011, many of the men that get diagnosed with prostate cancer because of this controversial PSA test really have no symptoms at all. and they come into the doctor, they get the test, and then they're told by the doctor their PSA is elevated, and they may need to have the next step, which would be to do a prostate biopsy. So, it does become rather confusing because a lot of men, they get diagnosed, say, I don't understand. What do you mean I have prostate cancer? I don't have any symptoms at all.
We are talking today about preventing, detecting, and treating cancer of the prostate gland. If you have a question about prostate cancer or a story to share, you can give us a call. Our lines are open, 888-472-3366. You can also get through on email. It's joe@peoplespharmacy.com or terry@peoplespharmacy.com, Terry. You can reach us through Twitter. We're at People's Pharmacy.
Dr. Katz, the PSA brouhaha that has exploded in the last several weeks, I would say it's at least as bad, maybe worse, than the mammogram mess. And men are totally confused. There are some men who have had prostate cancer and are just up in arms and saying this is outrageous. There are many urologists, your colleagues, who are very upset about the U.S. Preventive Task Force Services.
The U.S. Preventive Services Task Force.
We didn't get that quite
Yes.
right, did we? Anyway, bottom line, there is tremendous controversy, tremendous anger, tremendous angst. Please put it all into perspective.
Well, let's remember what we're talking about. We're talking about the PSA, the prostate-specific antigen test, which is a blood test. And the PSA, the antigen or the protein, is only made in the prostate. No other organ or tissue in the body makes PSA. So it's prostate specific, but it's not cancer specific. So what that means is that if the test goes up, it doesn't necessarily mean that you have cancer. It could be, as I was talking about earlier, this benign growth of the prostate, or it could be that there's a urinary tract infection, or it could be that you had sexual relations the night before. So there are what we call a lot of false positive elevations for the PSA, and that, in my experience, causes a lot of anxiety. In fact, I often refer to the PSA as the patient-stimulated anxiety test because it really can cause a lot of men anxiety when they get that phone call from the doctor the next day. But there's no other place in the body that we know of where screening for a cancer can be so specific as it is with prostate cancer, because for breast cancer, let's say, we don't have a breast-specific antigen. We don't have a colon-specific antigen. And I think over the last 20 years that we've been using PSA, in my own experience as well, there's no doubt that we have seen an explosion in the number of cases of prostate cancer in this country. That's clear. Well, what we've also seen is that the number of men that get diagnosed today is a different type of stage of disease. When I was training as a resident, before PSA came about, and we didn't have this way of screening and detecting, many men would come in with already symptoms of metastatic prostate cancer, where they had pain in the bone, where they had anemia, weight loss, fatigue. And those patients clearly are no longer curable. In fact, their lifespan is very limited. Today, we see the majority of these patients have really no symptoms, and so the controversy becomes, if you get diagnosed with prostate cancer, do you need treatment? Because what we're detecting now is we're detecting a much earlier stage of disease where the cancer may be biologically insignificant. And many of these cancers that we detect, which are very small, microscopic, you can't see it on a CAT scan or an MRI. You can't feel it on the digital exam. And the only way that we know about it is the PSA. But there's no doubt that PSA, in my mind, has saved many men's lives in this country. I mean, every day of the week, I see patients that if they didn't have the PSA, their cancer would have been detected at a much later stage. There has been some controversy about how many men we need to diagnose before we make an impact. Is it 40 men we need to diagnose before we can save a life? Is it 15 men? But if it's your life, does it really matter? Don't you want to know that if it's your particular cancer, that, if you need to be treated, this is going to be an important factor for you.
Now, of course, Dr. Katz, there are some what should we say, difficulties with this test, because there are men who have low PSAs and have very serious prostate cancer, aggressive prostate cancer. There are men with relatively high PSAs who have no prostate cancer, as you mentioned, or have relatively, quote-unquote, benign cancer. I mentioned earlier that 80% of men over the age of 80 will have prostate cancer, and probably if you live long enough, it's 100%. Most of those men won't die from it. In fact, they won't even know they have it. They'll die with it, not from it.
Right, but I think what we need to know is the information, because as you said, we can't always rely on the PSA to predict the aggressiveness of the cancer. And today, I think that the issue is more about if a man has the diagnosis, should he be treated? That's where the task force, I think, fell short. They should have set up and tried to come up with better guidelines for which men should be treated than saying we shouldn't be doing any screening at all. Because if we stop doing screening for all men over the age of 50, which the task force has declared as their conclusion from the available literature today, so many of these men are going to develop cancers, and many of them will develop aggressive cancers, and many of them will die. So I think that we need to do a much better job at determining who should be treated and who should not be treated, because there's no doubt in my mind that, yes, we've seen an explosion in the number of cancers detected, but we've also been over-treating so many men. And unfortunately, even in the best of hands, the treatment can come with some serious long-term, lifelong side effects for men. And that's really where the issue is. It's not, well, if we just take out your prostate, it doesn't matter, you'll be fine. But unfortunately, men can develop, urinary leakage, incontinence, sexual dysfunction, erectile dysfunction. And, some of these things don't go away. And so the question is, did that man need to be treated? Was the risk of his cancer so much greater than the benefit of having it out?
And Dr. Katz, that is the crux of what the U.S. Preventive Services Task Force was recommending, isn't it? They were saying, because we are screening with PSA, we are overtreating a lot of men who are then suffering the consequences.
That is absolutely correct. That is correct. But I think to not do the screening, I think, again, we should be placing more emphasis, because we know that so many of these men, let's say the typical guy who has a prostate biopsy, he's going to have 12 quarters of tissue. At 12 quarters of tissue, if he only has one area of cancer and it's not aggressive, does he really need to have that full prostate removed and undergo the entire robotic surgery or radical prostatectomy or full radiation?
Well, Dr.
That's what
Katz,
we need to talk about.
Dr. Katz, we're going to answer that question when we come back. We're going to take a short break. We'll take your calls and questions for Dr. Katz at 888-472-3366. If the lines are full, you can email us, Joe or Terry, at peoplespharmacy.com, or send us a message through Twitter, at People's Pharmacy. Again, the number, 888-472-3366.
You're listening to the People's Pharmacy with Joe and Terry Graydon. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible by Red X Industries, makers of Utter Cream and Utterly Smooth Extra Care Cream enriched with urea. They're to moisturize dry, cracked skin. The number 800-345-7339. The website is uttercream.com.
And by Car Drug, nationally recognized for rethinking the role of community pharmacy through its community health centers, offering immunizations, screenings, and medication counseling online at kerrdrug.com.
If you would like a CD of this show, you can call 800-732-2334. This is show number 837, or visit our website, peoplespharmacy.com.
Today on the People's Pharmacy, we're talking about prostate cancer, diagnosis, treatment, and prevention. You can share your story or ask a question at 888-472-3366. 888-888-3366. You can send us a message by way of Twitter. We're at People's Pharmacy. Or you can send email to Joe at People's Pharmacy or Terry at People's Pharmacy. It's Terry.
Our guest today is Dr. Aaron Katz, Director of the Center for Holistic Urology and Professor of Clinical Urology at Columbia University College of Physicians and Surgeons. He has written The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies.
And Dr. Katz, if routine PSA screening were dropped for men with no symptoms, because that is the recommendation from the Preventive Services Task Force, what symptoms would prompt a man to go see his doctor?
Well, besides the common urinary tract symptoms, like getting up at night or having some decreased force of stream or straining to urinate or maybe seeing blood in the urine, those, again, can be signs of prostate cancer, but maybe just signs of benign tissue growth along the urethra from the prostate. But if cancer does spread to the outside of the prostate from prostate cancer, then we're talking about men that may have back pain because prostate cancer can go to the bones. It can spread to the lymph nodes. You may see some swelling of the legs. There will be some fatigue if the cancer gets into the bone marrow and replaces the marrow. Anemia will set in. And unfortunately, the only therapy for these men would be hormonal therapy. These men are no longer considered curable. Not that they can't live long, because we do see patients that live many years, even despite having, these metastatic deposits in lymph nodes or bones. And today, beyond hormone therapy, we've made advances in chemotherapy. There's been new therapies like immune therapy that recently have come out, looking at our ways of attacking these cancer cells using our own immune system, which is quite intriguing. And then there's new second and third generation hormonal therapies that have recently been FDA approved. So men are living longer even despite having a metastatic disease. It does come into the question, though, about quality of life, not just duration of life, because if you are on all of these medications and have metastatic prostate cancer or any cancer that's beyond the organ, your quality of life, your energy level, your ability to function may be limited.
Dr. Katz, in a minute we're going to ask you about the biopsy and the Gleason score and how to interpret it and when to do something and then what to do, because that gets very confusing. There are so many different treatments, but we'd like to turn to the telephones and take calls from our listeners. Let's go to Rebecca. Terry, where is she?
Bedford County, Virginia. Welcome to the People's Pharmacy, Rebecca. Your question, please.
Thank you for taking my call. Well, it's more of a something I wanted to share. I wish that we had had this information years ago, because in early 2002, my late husband, had his annual physical. He had his PSA test. He was already retired, and so this was, an annual thing. And it was always late February, early March. Normal test, no problem. That was in 2002. But within 5 or 6 months, he was having back pain and urinary problems. He went to his doctor. Doctor treated him for bladder infection or whatever for a few weeks, didn't clear up, so he sent him to a urologist. Now, I don't know why the MD didn't do this, but the urologist took a PSA test, and it was in the high 80s. And Jerry ended up with a lot of problems. It had already metastasized into the bone marrow of his hip and lower back. So...
Well, I'm very sorry to hear that. Yeah.
Well, thanks. Well, it was 8 years ago, a few weeks ago. So time goes on.
Here, so you're talking about, unfortunately, your late husband, who is the reason that I do believe that PSA should stay in the armamentarium of medical doctors and urologists to do screening. Now, with your husband, it would be a little bit different because it sounds like he was having symptoms already. So that might be a little bit different than the task force, who is saying, well, we don't want to do screening on men 50 years older without any symptoms.
But Dr.
I still
Katz,
think, yes.
What Rebecca said is that he did have a regular screening test, PSA, which was normal as part of his annual physical, and then within 6 or 8 months, the prostate cancer had declared itself, as it were.
Well,
so we're talking about a situation in which the annual PSA did not reveal the cancer.
Possibly. I will say, though, that, of course, we don't have all of the information here. And, he was a young man. What was reported as a normal PSA may not have been normal for his age. And there are age-specific ranges. Now, it is possible that it was normal even for his age and that the cancer just exploded in a few months. It's not that common for prostate cancer. Yes, I've seen it. I've read cases for it, and I've seen it personally in my own practice, but it's not that common. But it would have, we would probably need to look at more information about his exact PSA at the age of diagnosis and when he was...
Yeah. Dr. Katz, what this does bring up, though, and it is one of the big controversies, is that some men have aggressive prostate cancer, and it explodes, whether it's 6 months or a year or two, and it kills them within a few years. And other men, excuse me, can live with their prostate cancer for decades, and it never really does anything. Do we have an understanding of why that is?
Well, we typically rely on the why someone gets more aggressive prostate cancer than others is unclear. I mean, certainly African American men that get diagnosed earlier do have more aggressive cancer. Whether that's genetics that plays a role, whether it's diet that plays a role, is unclear. Hormonal levels have been looked at; it's still unclear. What we have to rely on right now, when someone has an elevated PSA and they go on to that next step and have a biopsy, is to look at what's called their Gleason score. That's a grading system based upon their pathological diagnosis. So the pathologist looks under the microscope at the cells and can grade your cancer and give you a number on a scale, typically from 6 to 10, 6 being the lowest number, least aggressive, and then 10 being, very aggressive. And, typically the 8s, 9s, and 10s do need, rather urgent treatment, because those are the cells that are rapidly dividing and can get out of the prostate cancer capsule and extend into the lymph node and into the bone. But many times today, with routine PSA screening, if the PSA goes up in the next year and we do a biopsy and we detect it early, many of these cancers are Gleason 6. They're low volume, and we look at the number of cores. We typically take 12 to 14 cores on a biopsy. We can tell you what volume of prostate cancer you have, what your Gleason score is, and then determine, based upon nomograms in large populations, whether or not you need treatment at all. And many of the patients that we do see that have these low volume, low aggressive cancers do not need urgent treatment, or may never need treatment at all. And that's why at our center we've established this active holistic surveillance program, a watchful waiting, which was termed in the past, for many of these men that can just watch these low-lying cancers and live excellent quality of lives and not undergo radiation or surgery.
Dr. Katz, we want to come back to active surveillance, but I did want to ask you, you indicated that a high Gleason score of 8 or 9, I believe you said, indicated a need for urgent treatment.
Yes.
But I would like to clarify the nature of the urgency. With prostate cancer, there's nothing scarier than hearing you have cancer. And men may be inclined to think, let's do something about it today, tomorrow, this week, next week. Even with a high Gleason score, you do have a couple of weeks to think about what treatment you want, do you not?
Yes, you do. Although that would really depend upon the PSA. Like if I saw a patient that came in today and he had a Gleason 8 and a PSA of 80, okay, I'm going to start him right away on treatment. Okay, I do think that is, we don't know how long this is the first time. I don't know maybe how long he's had this, but if I'm looking at one point in time and he's coming into my office with a high Gleason and a high PSA, I'm going to be rather forceful with that patient that he should go on to some treatment right away. At least start with some hormonal treatment and put the cancer into a remission. And then we can talk about some definitive treatment. And then he would need some staging evaluation to see whether or not, that patient with a Gleason 8 or 9, those patients need to be staged. Those patients need to have a CAT scan, a bone scan, and an MRI. Not everyone with prostate cancer needs that. In 10, 15 years ago, everyone with prostate cancer would get a CAT scan and a bone scan. Well, we don't need to do that today. And we can cut costs by eliminating the number of scans that patients need to undergo and the radiation that they're exposed to. But certainly as someone that you're presenting to me with a very high Gleason and a high PSA does need to undergo a staging evaluation and, it would benefit for sure with immediate treatment, at least starting with some hormonal therapy to put him into a biochemical remission.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
Our guest today is Dr. Aaron Katz, Director of the Center for Holistic Urology and Professor of Clinical Urology at Columbia University College of Physicians and Surgeons. He's written the definitive guide to prostate cancer, Everything You Need to Know About Conventional and Integrative Therapies. We're going to go back to the phones in a second, but Dr. Katz, I want you to start thinking, because a lot of men become quite confused once they have been diagnosed with prostate cancer, once they've had a biopsy that says, yes, your Gleason score is 7 or greater and you need to do something. Then the question is what to do. Do you have a radical prostatectomy? Do you have an open? That is to say, have a major surgery? Do you have the Da Vinci robotic surgery, which is not minor surgery? Do you have cryotherapy, which is freezing it? Do you have brachytherapy, which are the tubes of radioactive something or others? Do you have the external beam? Do you have the proton beam? Do you have hormones? What to do? It's extraordinarily confusing. But first, let's go back to the phones and talk to, who is next, Terry? Robert?
Robert in Berkeley Springs, West Virginia. Welcome to the People's Pharmacy. Robert, we'd like to hear your story.
Well, my story is when I was 73 years old, I had a prostate of 0.4. I went to the urologist. He did a biopsy and found I had cancer. The diagnosis was what to do about it. I chose radical surgery, had my prostate removed, and my prostate PSA stayed 0.1 for 3 years. Then it started to climb. I'm 86 years old now, and my prostate PSA has climbed to 28. I get 6-month digital exams, and the last 4 or 6 years I've had every 2 years a bone scan, which is negative. And my urologist said that the best thing is if it reached 30, I should consider hormone treatments. What is your take on this?
Dr. Katz, I wonder if you could explain to the rest of us first, since Robert has had his prostate removed, why does he have prostate-specific antigen in his body?
Exactly. And, the ideal case, if you have prostate cancer surgery, whether it be robotic or open, is that at 6 weeks, your PSA, if all of your prostate cancer is removed, should be 0. And it should be 0 at 5 years and at 10. Unfortunately, though, around 20% of the men that undergo definitive therapy with radical prostatectomy will have a PSA recurrence. And this typically does mean that there has been cancer left behind at the margin. It can be some benign tissue that was left behind, and I've seen that in several patients that have come to me for referrals. But by and large, the majority of patients that do have a PSA rise, especially as high as 30 now in your particular case, Robert, is a recurrence of prostate cancer. It could have been cancer that was detected in the lymph, that was not removed from the lymph nodes, or it was outside the prostatic capsule. There's no evidence that waiting till 30, as you're asking me, do you need a magic number of 30 before starting hormones? In fact, most people would have probably started you at hormones much, much earlier. The fact is that, you're in your 80s. You may not have been affected by this cancer at this point. If it's not in the bones and you don't necessarily have a progression, the bone scans are clear, hormonal therapy can have other side effects to you that you need to know about, especially if you're in your 80s. There have been some studies showing that men that are on hormonal therapy are much more likely to have a cardiovascular event, a thromboembolic event like a stroke. There can be cognitive changes, hot flashes, weight gains, and all kinds of these, biochemical effects that can occur to men. So, I'm not so sure that at this point you may have, proven that you may not need hormonal therapy, sir, in your particular case, especially if your bone scan remains clear of disease.
Dr. Katz, thank you very much for answering Robert's question as best you could. Obviously, Robert, you're going to need to discuss this with your own personal physician. We can't make diagnoses or recommendations over the telephone. But that does get us to the whole question of treatment. And we only have a minute before we go to the break. But how do you recommend a man proceed once he has a definitive diagnosis of prostate cancer? If he goes in the door at radiation therapy, someone's going to recommend radiation. Some urologists are going to recommend radical prostatectomy. Others are going to recommend cryotherapy, which is one of your specialties. How do you even begin to decide?
Well, the first thing I do when I'm looking at the patient is I want to determine if that patient needs treatment. And I look at the PSA, his PSA velocity over time, how quickly his PSA was rising, because once you have a diagnosis, that can give us an idea of the proliferation or how rapidly this cancer has been growing. And then I look at the pathology report, look at how much cancer there is, whether it's aggressive, and then look at the patient individually. How old is this patient? What kind of shape is he in? Is he 70 but really functioning like a 55-year-old, or is he 70 and he's functioning like an 85-year-old? And we do see patients that are in their 70s and 80s that get diagnosed with prostate cancer that really have an excellent quality of life, longevity, have no other significant medical problems, are very active, in great shape, sexually active. All of these factors have to be taken into account. And the other thing that has to be taken into account, which is not clearly written in the textbooks, is the overall patient anxiety with their cancer. Do they really want to have treatment? And I think proper education is extremely important for so many of these men.
We need to take another break. When we come back, we'll talk more about prostate cancer and treatment and prevention. And we'll talk about your questions and your stories at 888-472-3366 or by email Joe or Terry at peoplespharmacy.com.
You're listening to the People's Pharmacy with Joe and Terry Graydon.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Car Drug, North Carolina's hometown pharmacy, whose pharmacists offer a wide range of services including immunizations, health screenings, and medication counseling. Located in communities across the state. Online at kerrdrug.com.
And by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel soft and smooth. The number is 800-345-7339. The website is uttercream.com.
Today on the People's Pharmacy, we're talking about prostate cancer. We're discussing conventional and complementary therapies for this disease, and we welcome your stories and your questions about it. The number, 888-472-3366. You can email us. It's joe at peoplespharmacy.com. And we can also get your messages by way of Twitter at People's Pharmacy.
And Facebook. We'd be happy to take your messages on Facebook. Become a fan. Our guest today is Dr. Aaron Katz, Director of the Center for Holistic Urology and a Professor of Clinical Urology at Columbia University. He's author of The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies. And this notion of an older man getting a PSA test. We know a gentleman who was 85, and his PSA test was elevated, and he had a biopsy. That led to hormone treatment and eventually radiation therapy. Is that appropriate these days?
Well, it does need to be individualized at that age, I think. I have patients in my practice that are in their 80s. I can think of a gentleman right now who's extremely active. He's an author. He's had prostate cancer in his own family. He was very concerned about it. He's been following his PSA for many years. His PSA recently spiked up, and I had a discussion with him about whether or not he wants to have a biopsy. And he, it came down to a level of anxiety that this patient really wanted to know about whether or not he has prostate cancer, because he felt like he could live, even though he's 82, he felt like he could live another 20 years or maybe more. And if there was something there, he wanted to have it attacked. And we did what's called a focal. He did have a small area of cancer. And I did a focal ablation, a cryoablation, where we, instead of attacking the entire prostate, we found one little area of prostate cancer, and he wanted to have it treated. And we put a needle in it and froze it using focal cryotherapy, which I think is going to take off a lot more in the next few years, a focal way of treating cancers of the prostate, whether it be with cryotherapy or laser-guided therapy. And it's taken off already in other cancers where we were seeing, the modified mastectomy or the lumpectomy for breast cancer. We're doing much more partial nephrectomies for kidney cancer than removing the entire kidney. So this concept of trying to retain the normal organ and just remove the cancer or ablate the cancerous area is going to, I think, pick up quite a bit for prostate cancer as well. But, getting back to your question, is it appropriate for all men of 85 to get a PSA? No, I think it's not. I think we have to, again, individualize and educate the patient as to what the PSA really means. And then if it is elevated, do they want to take the next step and undergo a prostate biopsy?
Dr. Katz, David in Chapel Hill has emailed. He says in many other places, the preferred treatment for prostate cancer is HIFU. I wonder if perhaps you could tell us a little bit about what HIFU is, and then tell us about the pros and cons of the major treatments that are available for prostate cancer.
Sure. HIFU is high-intensity focused ultrasound, basically directing ultrasound waves or heat energy into the prostate. It's currently not FDA approved in the United States. There has been some recent excitement in the European markets and European centers, I should say, about doing HIFU, and some of the studies are showing that it may be quite effective. There are clinical trials ongoing in the United States right now. It may be FDA approved in a few years here. It's an outpatient procedure. Much like cryotherapy, it's ultrasound guided. So whether you use cold therapy or heat or hot therapy, let's say, the idea is the same, to focally ablate these lesions. Probably the newest kid on the block, I guess, for prostate cancer, which I think has revolutionized the way the prostates are removed, is the robotics or the Da Vinci. And the majority of major medical centers have these. I'd say probably all of them right now in the United States, and even many of the community hospitals have taken on buying these $1.7 million robots. The robots don't do the surgery. They aid the surgeon. The surgeon actually can sit at a console about a few yards away from the patient and actually control the robotic arms going into the patient. In my experience and looking at prostate cancer therapies over the last few years, there's no doubt that this has revolutionized the way that if you do decide to have your prostate removed, if you're young, let's say, and you have aggressive cancer and you're going to have your prostate removed, I think that if you're in reasonable shape and you're not very obese and you haven't had multiple abdominal scars, then probably you should have a robotic procedure. Although I will tell you that it is, in my opinion, and many others, still considered major pelvic surgery. The blood loss is less, the hospitalization is less, the recovery time still can be, several weeks to months after this procedure with regaining your urinary control as well as sexual function. So don't think, I'm just going to have a robot. It's kind of a walk in the park and I'll be back to work the next day. That's not the case at all. And in fact, you'll have a catheter in the bladder for a week to 10 days. And it is major surgery, and it's a time for healing and recovery. And but I do think that in experienced hands, and I think if you're considering this option, that you have a very honest discussion with the surgeon and ask him, how many cases have you done? Have you published your outcomes? What are your complications? What are your PSA outcomes with this procedure? Because there is a steep learning curve to doing these robotic surgeries, and I think you probably should be doing these or having your surgeon do it on you if he's done at least 500 or 600 of them. That's the kind of a learning experience you need with this. But there are many of these experienced surgeons throughout the country and in academic centers, and the studies have shown that in the centers that do more, that their complications go down and their cure rates do go up.
Well, let's turn to another topic. Joe in Raleigh, North Carolina, welcome to the People's Pharmacy. Your question or comment, please.
Hi, thanks for taking my call. Dr. Katz, I'm interested to understand more about the rate of prostate cancer in the United States as compared to the rest of the world, and how diet may impact that.
Well, I think that's a great question, and I think diet impacts it a lot. If you look around the world, there's no doubt that in the Asian countries where there is more soy consumption, more fish consumption, more plant-based therapy, plants, in the diet, that we're seeing lower incidence of prostate cancer, the lowest incidence of prostate cancer deaths in the Asian countries, the Mediterranean countries. And then when these people come to the United States, their rates of prostate cancer go up. And I think, and many of the studies have shown, that it's probably related to the amount of fat in the diet. That the American diet, which is much higher in red meats, in more fats, less in plants and soy, the prostate cancer incidence goes way up, and so does the death rate of this cancer. So, yes, I think that diet does play a role, and many of the patients that get diagnosed that I see that are considering an active surveillance, I change their diet around, and I, reduce their red meat and have them stay away from fried foods, and then add some of the other herbal compounds that we have studied, antioxidants like green tea and some of the other herbal things that we found healthy for patients, and as well as vitamin D. I know that you were at the top of the hour. They talked about vitamin D and some of the cancers. We've studied vitamin D at our own institution. In 3,000 patients, 70% of our patients with prostate cancer were deficient in vitamin D. And many of the studies are now showing that the further we go from the equator, the lower the vitamin D levels in our blood, and the higher the rates of many disorders like diabetes and cancer, and prostate cancer is one of them. And so I routinely always get a vitamin D level in my patients and supplement them if needed.
And how much D would be in that supplement, Dr. Katz?
I typically start out with around 4,000 to 5,000 units a day. I think that's relatively safe. I haven't had any problems with any of my patients. And then repeat the vitamin D typically in around 3 months. And I like my patients to be somewhere around the 40 to 50 range of vitamin D in their blood tests. Many of these patients that get diagnosed are extremely low levels of vitamin D, and they need supplementation.
Dr. Katz, your subtitle of your book is Everything You Need to Know About Conventional and Integrative Therapies. And we've talked about conventional, we've talked about cryotherapy, we've talked a little bit about radical prostatectomy with the robotic, the Da Vinci. We've talked a little bit about, the hormonal treatments. But what about integrative? What do you recommend when somebody has maybe a slightly elevated PSA or maybe even a low Gleason score on biopsy? What kinds of integrative approaches make sense from your perspective?
The first thing you have to do is look at the diet and see how much of fatty foods they're taking in. I try to reduce the amount of fats, reduce the amount of fried foods and sugars. A lot of the sugars that men take in can grow these cancers. I add in antioxidants. Take away
Such
the
as?
diet sodas. Well, take away the diet sodas and add in the green tea, curcumin. We've been using a dietary supplement that's sold in health food stores called Zyflamend. It's an herbal anti-inflammatory.
Please spell it.
Shown it's Zyflamend. It's Z as in zebra, YFLAMEND. It's made by a company called New Chapter in Brattleboro, Vermont. And, we studied this compound. It's part of my active holistic program. It contains 8 different herbal compounds that within the herbs have low levels of anti-inflammatory properties. And if you reduce inflammation, you can cut off the pathway of prostate cancer proliferation. And this is also true for many other cancers where inflammation is tied into the development of a cancer. Bronchitis from smoking, inflammation of the lining of the of the lungs leading to cancer. Diverticulitis from many different factors, from Crohn's disease leading to colon cancer. So we see these chronic inflammations. So I believe if we can restore that and reduce inflammation in our body, we can reduce cancers. I like pomegranate extracts. There have been a number of studies looking at pomegranate juice and pomegranate extract pills to extend the PSA doubling time. And PSA doubling time can be a kind of a surrogate for how well patients are going to do. If we can extend the time that it takes for their PSA to double, we can extend their lives. And so I use that. I use the Mediterranean diet, having patients cook with more olive oil, having them take in stewed tomatoes, which has high amounts of lycopene, soy compounds. There's been a number of different soy compounds from Japan that we've used, as well as a medicinal Japanese mushroom product that we've studied to enhance your own body's immune system naturally to fight off cancer.
And Dr.
And I think, yes.
I was going to say, we found a recent study that was published in Cancer Prevention Research that substantiates the dietary approach you were suggesting. There was a comparison of a low-fat diet with fish oil supplements and a standard Western diet, which is much higher in fat, done at UCLA. And this was done for men about a month before they had their prostates removed. And the men who were on the low-fat diet with the fish oil had a different, slower growing prostate cancer cells.
Yes. That's just another study in the evidence there that diet really can play a role. I also think, though, that exercise is extremely important. And I think the two basic things that men need to focus on is diet and exercise. And they feel so much better. I mean, time and time again, patients come back. Their PSAs are either stabilized or they're dropping if they're on this active surveillance. And this is, again, not for every prostate cancer patient, but for the general or the majority of men in this country, I think, that have these Gleason 6s and their PSAs are under 10, and by the National Cancer Institute guidelines, they're considered to be a very low-risk prostate cancer patient, that this active surveillance approach can be an excellent choice for many of them. But they do need to be monitored. They do need to watch their PSA. I recommend a PSA every 3 months in the same lab for the next 2 years. And I do recommend that if you're going to go on active surveillance, it's reasonable to do another biopsy in a year. Because as we were saying earlier, PSA itself cannot always determine the cancer. So I like to rebiopsy men just to make sure, even if their PSAs are stable, one more what I consider a confirmatory biopsy, just to make sure that there's no significant increase in the cancer growth. Diet, exercise, mind-body therapies. We have an acupuncturist in our center that helps men with stress and other, if they have some prostatitis or some pelvic floor spasms. That's been an excellent modality, acupuncture. As well as I've incorporated into my own life yoga. I think this can be extremely helpful for men, especially as we're getting into our 50s and 60s. You may not want to be out there running because you have a bad knee or hip. I think that yoga and things like that can be extremely helpful.
Okay.
And these things that I recommend are also not only great for the prostate, though, but are also extremely good for the other major health concern that men have, which is cardiovascular.
Dr. Katz, we are just about out of time.
Great.
We would like you to tell us what your crystal ball holds for the future in the 1 minute we have left. Research coming down the pike, new drugs. Are you optimistic or pessimistic?
I'm extremely optimistic. I think that what we're going to be doing over the next few years is going to be coming up with a better PSA test, We have a few ones that are available now, like a PCA3 urine test, which I routinely use in my office. But we're going to be using other tests, other markers that will not only tell us if you have cancer, but if you have that type of a cancer that needs treatment. Or can you just go home and exhume and incorporate these things that I'm talking about into your diet and lifestyle and not undergo the major treatments like radiation or surgery. That's where I think we're going to be more tailored, more individualized medicine so that we can look at your genetics and look at if you do have these cancers, is this the one that's going to need treatment or not?
Well, that is all the time we have today. Thank you for listening to the People's Pharmacy, and thanks to our guest, Dr. Aaron Katz. He's director for the Center for Holistic Urology and professor of clinical urology at Columbia University College of Physicians and Surgeons. His new book is The Definitive Guide to Prostate Cancer, Everything You Need to Know About Conventional and Integrative Therapies. There's a link to his website on our site, and you can tune in to his radio show Sunday morning at 7 on WABC New York at 770, or you can find his podcast. It's at WABC.com and look for Katz's Corner.
And that's spelled K-A-T-Z''S. Lynn Siegel produced today's show and provided technical assistance. Peter Bombar and Al Wodarski are our engineers. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
Next week, we'll find out what ecology and evolution have to teach us about health. Our guest will be Rob Dunn, author of The Wild Life of Our Bodies.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show, number 837. That number again, 800-732-2334. or you can find it on our website, peoplespharmacy.com. And we're going to ask Dr. Katz a few questions after we sign off today, and we'll put them up as a bonus interview because we only covered a few of the topics we wanted to discuss, and we have lots of email questions to share. All of that, again, at peoplespharmacy.com, where you can also sign up for our free email newsletter or our free podcast of our show. You can also find out about some holiday goodies at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week.